So this is one that came to our Veteran Service Office. It's a thank you card. I really appreciate all you have done to help me. I could not have done it on my own.
We get heartfelt letters from people who want to acknowledge the change in their life.
Thank you for coming to help guide me back on track.
Thank you so much for helping me, not judging me, for caring about people in the community.
I didn't think there were people out there like that.
We hear over and over about the mental health of kids, of adults, of veterans.
You know, it can be everything from just having a tough day to having a family member that's actually chronically mentally ill. So it runs the whole gamut, but we all have mental health.
The impact and the difference you make should be commended, realized, and lifted up. We are making a difference in people's lives. We are getting them the help they need.
I wish every county and city in America had this great program.
The Mental Health Initiative in Douglas County has grown by leaps and bounds.
The Mental Health Initiative saves lives. It will save more lives. It has saved lives already.
We now have 7 co-response teams for the public and 2 teams that are dedicated just to kids in schools.
It sounds like your counselor was a little bit concerned about you. Can you tell me what's been going on?
We're able to cover all the schools in Douglas County, the private schools, the charter schools, and the district schools.
So would you be open if they gave you or your mom a call?
And that's been tremendously successful.
We know the earlier a child gets help, the better off they will be in the future.
We also expanded something called the Care Compact.
911, what is the address of your emergency?
And the Care Compact is a partnership of about 12 organizations, all of whom provide case management.
Just taking the time and being able to sit with them, find out what they need, find out how we can help them get that. It's amazing.
Why is that important? Because you cannot just go out and respond to emergency situations.
We're here today because we got a phone call that you might want to hurt yourself.
You have to have an infrastructure behind that, making sure they stay connected with treatment, and if they need medication, making sure they have access to that.
Let's get them in a good place going forward and help them so they can continue moving forward.
Suicide is obviously the ultimate tragedy associated with behavioral health. Programs that focus on postpartum depression, older adults, middle-aged men, LGBTQ+ youth.
What does it do to you?
Well, try to name something it doesn't do to you.
You crawl into your shell and you continue to fight these demons. And many of veterans who don't seek help, don't know where to go for help, become one of the 22. It's 22 a day. 22 veteran suicides a day, every day. That is totally unacceptable.
You know, if you've ever dropped a rock in water, you see the ripple effect that goes out. And you never know where all those ripples go, but they go somewhere. We'll never know the entire impact of what our mental health initiative has done, but we know that we have reached corners that were never reached before.